Good afternoon, and thank you for listening to our podcast. I'm Jennifer Hurt, AVP of Communications and Member Engagement with the District of Columbia Hospital Association, and I will serve as the moderator for today's podcast. It's no secret that cybersecurity and healthcare technology have an impact on the healthcare industry. Today we have with us the President and CEO of ComplyAssistant, Gerry Blass, a highly respectable organization that provides healthcare compliance management software and professional consulting services. Gerry will help us better understand the current cybersecurity landscape and how to safeguard your hospital from risk. So welcome, Gerry.
Hi, Jen. Thanks for having me on today.
Absolutely. Thank you for joining us. So, Gerry, why don't we start out by just having you describe your background in healthcare IT and how it led you into the governance, risk, and compliance technology space.
Great. So I started in healthcare IT a long time ago, and in the days where there's just big mainframes in the basements of hospitals, and then I went on the vendor side, HIT vendors, and got a lot of experience there working with a number of hospitals. And of course, so much different back then with IT, really no implications of privacy and security issues. In fact, it was never even in anybody's mind that there would be potentially in the future information security problems with data. There was no motivation back then. There was no motivation to steal it or sell it. No one was making money on it. But then, in the 90s, I started to get experience with enterprise projects. I worked for a hospital system that when they merged, I was put in charge of the merger to standardize, and then Y2K came along, and that was an enterprise project. And so when HIPAA came around and information security started to become a problem, and privacy, I was put in charge of that because it was another enterprise type of project. What led to HIPAA was things like celebrity information that was leaked to, magazines and newspapers without their consent. It was things like employees selling medical charts to lawyers so that they could go after accident victims and try to help them, but that was an illegal way of attaining that information. That was a breach, and so the role of ISO began, Information Security Officer, and the concerns, and then throughout the first decade of the 2000s was when more incidents occurred due to motivation to make money. So that started happening, and there were also incidents like laptops that were lost or stolen, were not encrypted, and the HIPAA rule went into effect in 2003 and 2004, privacy and security, and the HIPAA wall of shame on HHS, so that there were rules around penalties and lawsuits that could occur. So it started to become a big concern and a big area to focus on. And then just to quickly move up to now, this day and age, the Meaningful Use Act and the Affordable Care Act went into effect in 2010, and that led to migration of hard copy medical records to electronic, and the main concern was meeting and attesting to the requirements of meaningful use, but maybe less attention around securing the data as it was transitioning to electronic health systems. And a lot of that activity occurred, a lot of stages of meaningful use between 2010 and 2015. And that's when cyber attackers realized that there was a lot of data electronic now, and to go after an attack, knowing that there was not a strong focus on the security of that information. And so that's where we started to see the attacks build up. And so the need for governance, risk, and compliance in healthcare really became needed around that time frame, 2015. That's when the government formed the CSA Act, the Cybersecurity Act, and that's when the attacks really picked up, leading up to today, where we know all the things that have happened that we could talk about. But everything becomes more impactful, and the need to have governance, it becomes stronger. Overall governance within healthcare organizations, risk management, and compliance management. So it's a very tough issue. There's a lot of other things we'll talk about today and go from there.
And to think that it happens, it's an everyday occurrence.
Yeah, I mean, just about every day you read about something.
So for those who may not be familiar with ComplyAssistant, and I should add that ComplyAssistant is one of DCHA's valuable associate members, so thank you for that, Gerry. But give us a
Thank
brief
you.
overview of how ComplyAssistant safeguards hospitals from risk.
Okay, so what we focus on are the pain points that a healthcare organization may be experiencing to address areas that are vulnerable, that have risk, that can lead attackers to find those vulnerabilities and to successfully attack. So the pain points are identified, and they're identified through audits. They're identified through interaction, discovery, conversations with healthcare organizations. And the need today is so tremendous for help for those organizations of really all sizes that the need for that is so important because of issues around budget constraints, resource constraints. We know that with nursing after the pandemic, and a lot of nurses left healthcare organizations and became agency nurses and contracted, and the cost of nursing skyrocketed, impacting the bottom lines of hospitals. There's also issues, even in the DC area with Medicaid cuts that are not in effect yet, but the potential impact, if they go into effect, could be very tough on the bottom line as well. So when a healthcare organization is dealing with so many aspects of what they need to do with their budget and how much of it could be devoted towards cybersecurity and AI, becomes a problem. So we try to identify that and focus on it and provide our solutions, our offerings, which are a combination of software that we call governance, risk, and compliance software, and also our services, which we call vCISO, virtual CISO, which is really covering administrative, technical, physical, and organizational controls, so that even if there's just one item on that list that a healthcare organization can't address, we can help them. And one of the biggest areas is with third-party risk management. That's a high-volume problem. Now it involves AI and cyber. And when you have budget constraints and resource constraints, that's such a tough area to address and to manage on the inside, on your own. It's something that we really specialize in, and it also comes into play with our software to automate it. So once we identify the area, we help, and then our software becomes the repository for evidence of due diligence of anything that is done, not only by us, but also by a healthcare organization on its own. It can be all documented, managed, everyone kept on track, and structured, organized way to go, as opposed to something like an Excel file.
So I see that ComplyAssistant, you've been in the industry for 20 years. Congratulations to that. But boy,
Thank
has
you.
technology changed in 20 years. So, how do you stay ahead of the technology curve?
So what we do is listen, to our clients. We understand everything that they're going through, and there's a lot of talent in healthcare organizations, and a lot of them are staying on top of it, and we have conversations all the time. We belong to organizations, for example, even belonging to DCHA and other associations provides an opportunity for us to, hear more from the great organizations. And DC has a number of prestigious organizations that we would love to have a lot of communication with. We belong to HIMSS, which is the Health Information Managers System Society. And of course, those events, national and chapter, offer a lot of information from, either providers or the third-party vendors who present there, keeping everybody up to date. We do podcasts, and the podcast, around a lot of it's been around AI and cyber, of course, and privacy. So we, prepare for those podcasts, and in doing so, it helps us to stay on top of, the main things that we want to cover. And like today, we do panel presentations at events like New Jersey Healthcare Association. Actually, it's the HFMA, the Healthcare Financial Managers Association. The chapter HIMSS, a lot in New Jersey and Philly and Delaware, and from third parties that we talk to as well. We were ambassadors for HICP, which is the healthcare industry cybersecurity practices. And now we belong to HSCC, which is the Health Sector Cybersecurity Council. And that's both national. So, in fact, I have a meeting today with HSCC. And right now, we have a work group or task force around AI and cyber, covering different verticals of healthcare. A lot of it around rural and critical access, where there's even worse budget constraints, and how do they implement controls? They need help. So that council is a tremendous combination of private and public sectors, and a large group of experts. So it is definitely a valuable thing to belong to. So there's a lot of ways, and just daily, every day, there's emails that come in with either stories around, the latest and greatest in healthcare innovation, and also around, the bad incidents that occur. So we are surrounded with social media to learn stuff, and just the world of communication that we're in to try to stay ahead of the curve.
So, what tips do you have for healthcare leaders? How can they stay ahead of the tech curve?
Okay, so if we're talking about, I was thinking about from a CEO standpoint. I know there's, the other healthcare leaders as well, but in focusing on CEOs, they definitely have to be part of governance, whether it's AI or cyber, because if they have a trusted team of other leaders that are working directly with like IT or information security, data privacy, AI, so they have to surround themselves with a great team and then become part of the governance, which means, meeting periodically with the team to stay on top. The folks that are at the table with the CEO, they should be the ones who are, staying on top of the curve at a more granular level, and then reporting that along with the current state of their own organization. So now CEOs can also obviously become part of, associations, and so one of the popular areas for CEOs is that they could join industry groups that focus on cybersecurity and AI, um, information sharing and analysis centers. So that's called ISAC, and it's H-ISAC, Health Information Sharing and Analytics. These networks allow organizations to share threat intelligence, stay informed about emerging threats, and collaborate on industry-wide cybersecurity initiatives. So, I mean, there's all kinds of granular areas, like, obviously the cybersecurity frameworks, staying ahead of AI in healthcare, and the team there, a governance team there, um, ensuring that AI and cybersecurity integrated. But of course, the CEO has a lot going on every day, so all these, items that I'm talking about would roll up to the CEO in a summarized fashion on the current state. Certainly need to understand that they're fostering a security-centric organizational culture, or culture of compliance, ensure ethical use of AI, um, leverage AI for proactive cybersecurity, adopt a resilient IT infrastructure. And this is, all this stuff is difficult and takes so much effort. So again, it's the folks like like the CIOs, the information security officers, the risk managers, compliance officers, HIM, everyone, all the directors that are of applications, using applications like part of the EHRs that are being driven by AI, other apps like radiology. The CEO has to stay ahead of the curve by being, um, very interactive with the team at the hospital that makes up the governance.
Well, with the average cost of a healthcare data breach being nearly $10 million, it certainly is important to stay ahead of the curve and make sure they have the pulse on what's happening. So why does
Mhm.
healthcare continue to incur the highest breach related cost across industries? I mean, $10 million, that's
Oh yeah,
astronomical.
yes, and so first of all, it's the complexity. So let's talk about um, why the cyber attackers go after the hospitals, and why the breaches cost so much, and why they're motivated from the healthcare organizations to make more per breach. But there's a lot of elements to it. First of all, the complexity, the value of the data. Healthcare organizations do not want to go down for a long period of time, like the network completely down, because the impact to the community, the impact patient care, the impact of financial. If you're down, you can't bill claims because it has to be done electronically. So the longer these attacks last, the longer they're down, healthcare organizations are being impacted geometrically week by week. And some have been down for 2 to 3 months. Used to be 3 days was the concern with a typical downtime, and that's been extended. Um, so they want to make a decision to get back up, and they'll pay. And overall, all these elements uh, lead to them paying higher costs. So the attackers know that, and that's the way it's been going. So that's why, again, having the AI governance in place to try to reduce risk, to know where the vulnerabilities are, um, and so they're not put in a position, even though everyone says it's when, not if, uh, but if they can avoid being in that position of, an attack that brings them down, impacting patient care such as chemo, dialysis, medical devices, ICU, ED, across the board, finance. Um, you know, it's just something that comes together that, and now AI is kind of, we'll talk about AI more, but AI does help the good guys and the bad guys. We can talk about that more. So there is the utilization of AI to help prevent downtime, and also the bad guys using AI to um, help them to have a successful attack. We'll talk about that more, I believe.
Yeah, so speaking of the bad guys, what's the weakest link in a healthcare organization or a hospital that they attack most?
Right. So it all goes around the human behavior. The weakest link is the human behavior. So the human behavior means from staff members, doctors, contractors, it's the employees, the staff, and probably the number one is the phishing and social engineering attacks. And with AI, phishing is becoming more genuine to the point where, it's almost getting to the point where, even if there's an email that has the CEO's picture and stuff like that, or whatever graphic is going to make it look real, the bad guys are using AI to generate phishing attacks that just seem, even from the messaging, to be more realistic and more tempting for an employee to click on or not to fear clicking on. So that's happening. The deep fakes, which are, one example in Hong Kong was an employee who's in finance who had a Zoom meeting with CEO, CFO, and COO, and he was instructed to transfer 25 million plus to another organization, and he did it, and then it turned out it wasn't them, it was a deep fake. Look like them, talk like them, and there was no reason not to believe that that was them. So policies and procedures really need to be in place around reasonableness of either Zoom meetings or internal meetings like that, or around the emails that come in, so that the policies and procedures are recommending reasonability checks. And then there's great apps that can be used to test phishing and deepfake type thing, so that employees are trained and become more aware of what could be, an email that could introduce malware and bring down a network. So that's weak. That's definitely a weak link. Weak passwords is another one, but now multi-factor authentication has come into play, and that should be in use everywhere. It's not necessarily in use everywhere right now, but it really needs to be, because that is a great tool to reduce access by breaking weak passwords and getting in to an application or getting into a network. Insurance companies are requiring it, so that should make it widespread. And it is certainly becoming more and more widespread. We all see it every day, but we have to get a code to key in for multi-factor authentication. So that's one of the weak areas, but also one of the areas that can be strengthened very quickly. Other aspects would be where there's unpatched software and outdated systems. Software needs to be updated continually with security patches. Operating systems need to be updated when they come out in applications, on endpoints. Medical devices are an issue because sometimes they can't be updated if they're hard coded, and so they could, and if they're put on the network, they are certainly a vulnerability if they don't have the latest and greatest in controls around access and getting on a network. Insider threats, we talked about some of those already. Those were really from the beginning where the threat started, but there still can be malicious intent and stealing data, and sharing credentials that they shouldn't do, or improperly disposing confidential documents. So that still can come into play as a weak link.
The bad guys, they're not only are they bad, but they're smart. And it's scary how AI can make them even more sophisticated in their phishing attempts.
That's right. That's
It,
right. And yeah, that's correct.
well,
Well,
Jerry, we were talking the other day, and you mentioned that in like a 6 year period of time from 2018 to 2023, ransomware attacks targeting healthcare organizations increased by almost 300%, I think 278%. Why such a dramatic jump?
yes, that's a great question. And, you know, right in the middle of that is the pandemic. Um, so initially, around 2018, the increases were due to, could be some of it due to AI, because, the big buzz around AI was the generative AI, but AI has been around longer, and it can help the bad guys to find the gaps more quickly to get into networks and to get on the network, and so that they can plant the seeds that make either take effect immediately or over time. But the pandemic, what that did, of course, was to cause havoc in healthcare organizations where, you know, even a CISO might be focusing more on setting up areas for vaccines, um, setting up the remote workforce that, obviously work from home now. There's more numbers of workstations, remote. Anytime there's more numbers of anything that can be attacked, the threats, the vulnerabilities go up. And that certainly happened during the pandemic. So the bad guys knew this, and that's why they're bad guys. They know that there's more vulnerabilities, right in that time frame. And now, coming out of the pandemic, there's other areas that are coming into play, and AI is one of them. That's really increasing in healthcare applications, and so I really do say in that time frame, I think the primary reason for the increase was certainly the pandemic.
So, why does it feel like hospitals are such an easy target for these hackers?
Yes, that is another great question. So the thing is, we talked about the sensitive data and the valuable information, the legacy systems and outdated infrastructure that a lot of hospitals have. Of course, a lot of hospital organizations are going to Epic, so they're all upgrading, but there's still plenty of them out there with legacy. Um, the attackers know that healthcare organizations are less likely to risk patient safety and shutting down. We talked about that before. And the weak cybersecurity practices or limited cybersecurity resources. Again, it goes back to the budget problems, poor security hygiene, um, with the password policies, encryption, multi-factor. Um, so if they're not following that stuff, like multi-factor, that could be an issue as well. Hopefully, the organizations are all making sure that they have it and their vendors are providing it for their applications. The human error, the phishing, regulatory pressures. You know, hospitals are under a lot of pressure from all kinds of regulations, including HIPAA, and they have tight deadlines, and so they have to focus there as well. The third-party vulnerabilities, look at Change Healthcare, um, interconnectedness. So, the medical devices being on networks, the third-party vendors causing 60% plus of the breaches. And so the attackers know if they go after a third-party vendor like Change Healthcare, that'll impact across the nation, which is just about every healthcare organization. Um, yeah, and again, the operational continuity. They know that hospitals do not want to have an extended downtime, so they have a big motivation there to cause havoc if they can bring down a big healthcare system. The In some cases, there is a lack of security culture and awareness. Hopefully, that's being focused on more. And again, the value of the PHI, the protected health information, is an incentive. So all that combined, some of it is a little bit redundant overall, but that's why you know attackers do believe that hospitals are an easy target and probably the number one prime target of all verticals around the world.
Yeah, that's scary. Our members
Hmm.
really need to hear that message. Now, I know we talked about AI a little bit, and we will have to have a whole nother podcast on AI because it's such a huge topic.
Hmm.
But it impacts nearly every industry. I know I'm a little scared of AI just from the standpoint of I want to know when something is created in AI.
Hmm.
So, what's the first step that hospitals should take when they're considering implementing AI? Or, tell us a little bit about what your role it plays in the services that you provide to hospitals in regards to AI.
Okay, so we'll start with that part of it. And for our organization, some of our services include the new risk assessment from NIST. It's called the NIST AI Risk Management Framework. It's the first version, and it's a great framework to go through and examine controls that are in place to reduce risk of introducing AI. The other part of it is we offer education around AI and also help with governance. So if an organization is implementing AI governance, which everyone should be now, we can help them and maybe even have a seat on their AI governance committee and attend meetings. So that's how our organization gets involved in it. And we also are looking to introduce it into our app, our GRC platform, which I can mention a little bit more about later. Um, so, and then as far as, you know, hospitals go, they really need to have that AI governance, and they need to make sure that if they are going to implement an application that's AI enabled, that is properly vetted. So the vendors that provide that, and most of the applications are vendor provided, and that's means that those vendors need to be vetted not only on cyber but on AI. And there's a whole bunch of things to look at from a vendor: their compliance and regulatory adherence, data privacy and security of the large language models, um, bias and fairnesses. There should not be biases in the information or hallucinations, which is where it's just bad data that can provide invalid results. And then clinical applications and like radiology and EHRs, you can't have hallucinations in there impacting protocols for treatment based on you know diagnoses and things like that. So really has to be a strong controls around vendors protecting their models of information that's being used by their clients to make decisions. Some of the decisions are routine, but some of them are very critical. Um, Ethical considerations and accountability that the vendors have in place, and incident response and AI failure management, making sure it doesn't fail. So there's a checklist of questions that can be asked of the vendors, and we've introduced those into our vetting of vendors. So when our clients are onboarding a new vendor, either they have us do it or they do it. They send electronic questions to them to answer around AI and, of course, cyber. And then, depending on the results, they can determine, does this vendor have a residual meaning after looking at the controls, their risk? Is it low, medium, or high? And why is it that way? And what documentation do they provide to support their answers to the questions? Policies, procedures, plans, testing, and even regulatory vendors should be undergoing what's called a SOC 2 certification. So the results of those certifications should be reviewed by hospitals. Um, so, I mean, it's we say
Oh, wow.
what is the first step, but there's just many steps.
Yeah, that's a lot to think about, a lot to take in.
Hmm.
So, as an expert in the field, and I know that you and your company, you deal with a lot of healthcare organizations and work with a lot of healthcare groups around the country. What are some of the significant concerns you hear from healthcare leaders, and how does your company address the challenges, or what advice do you have?
I think the thing that really impacted healthcare leaders was the Change Healthcare attack that impacted the nation and showed that even small providers who thought they were under the radar, if they were connected to a vendor like Change Healthcare, they were not under the radar anymore. So they got impacted. They were down. Some of them went out of business.
And that
Um,
actually was a human error, correct? That started Change Healthcare's attack?
um, yeah, I know that there was one human error, which was a different kind of attack, which was with CrowdStrike. That wasn't a cyber attack, but that was a software bug on a software upgrade. In Change Healthcare, I have to do a little refresh on, the exact reason for that one, but um, I think you're right. I think it was a human um, cause, and I'll check that out to verify that. But you know, bottom line is, again, the attacker probably used AI to get into Change Healthcare and to, you know, infiltrate it and have the impact because of the interconnectability across the nation. It impact so many organizations, and the total number of patients whose information was compromised up to now is about 190 million patients. So that's how big the impact was.
Yeah, and the impact is still being seen today.
Yes, exactly. Yeah,
So
that's right.
what else is on the horizon for ComplyAssistant in relation to AI and cybersecurity?
Well, we keep introducing more offerings as needed, and from a software standpoint, around third-party risk management, healthcare organizations may have, especially large ones, they could have up to 1,000 vendors that they need to get under control, understand their inherent risk, and properly vet them. And so when you talk about that many number of vendors and the questions the vendors have to answer and provide proof, to be able to take that all in and review it is a big task. It's very time consuming. So what we're going to try to do is introduce AI into evaluating the documentation part. The biggest focus will be around the documentation part, the policies, procedures, and plans, and comparing them through AI to frameworks that are in place. And the one framework that we are going to standardize on is HICS-CRIM, which is a health industry cybersecurity supply chain risk management controls that are in NIST CSF, which is the cybersecurity framework. And so the questions that are going to go out are going to be based on HICS-CRIM that are going out already. We're already using it. We've added AI questions to it, and getting the answers back instead of having to manually, by a subject matter expert, review documentation around 80 questions, or maybe there's a lack of documentation. But where there is documentation, that's takes a lot of time to review that to make sure it is in compliance with the requirement in the framework, in the regulatory framework. So if AI could do that, and we think it can, we'll introduce that to reduce the effort by 80% estimated. And then there's always the human oversight. So there's a 20% validation of what AI comes up with, and then to combine the answers from the vendors, like do you have this in place? Yes, no, partial, whatever. Their answers along with the proof or lack of through AI, we can substantially reduce the amount of time it's going to take to evaluate third-party vendors. So we looked at that in our platform as being the biggest area to focus on first to implement AI, and we hope to do so this year.
That sounds exciting. That sounds like something our members would really benefit from. So going back to the Change Healthcare cyber attack, I looked it up.
Oh,
And according to AI, I need to mention, it was triggered by a lack of multi-factor authentication on many
okay. There you
systems.
go. That's,
Now again, the AI, that's AI telling me that, so
yeah.
hopefully that's the fact. But lack of
But that,
multi-factor authentication.
yeah, see, and it's such a big deal now because, what that means if they don't have it in place, there could be passwords that were shared or weak passwords that the attackers can take advantage of. But with multi-factor, that goes away because the confirming code doesn't go to the attacker to get in; it goes to the user. So
User.
they'll see that. Um, that could also be an indication of an attack because let's say I'm a user in an application and I didn't log in. Say I'm not in, but I get an email saying confirm the login, then I know that it didn't come from me. So multi-factor is just so important, and that's great that you looked that up because that sounds. I would have a lot of faith that AI had the right answer on that one. Hmm.
Yeah, I think everybody should have two-factor, even from a personal standpoint.
Yes,
Personal account.
banking, your own whatever credit cards that you go to online and you sign in. You know, anything that is important to an individual, any site should have multi-factor. And
Absolutely.
yeah,
So, Gerry, it's been a pleasure speaking with you today. On behalf
same
of our
here.
members and listeners, thank you for the incredible work you're doing and educating us about the healthcare technology space.
Thank you,
I know
Jen.
I look forward to our next podcast to continue this important conversation.
Sure.
So we'll get that scheduled.
Okay.
But for our listeners, our ComplyAssistant will be presenting at our Healthcare and Innovation Summit on October 22nd. So please save the date and have a great day.
Thank you very much, Jen.
Thank
Appreciate
you.
it. Okay.